Na siya mga steps about sa nursing process, unsa ang iyahang mga plano or plan. So mao ni siya ang planning, the third step in the nursing process. So mao ni siya ang primero. It is the process of prioritizing nursing diagnosis and collaborative problems. It identifies measurable goals and outcomes, help to select appropriate interventions, help to document the plan of care. So, mao ni siya ang mga step sa planning. Primero, setting priorities. Kaduha, establishing goals. Ikatulo, selecting nursing intervention. Kaupat, documenting the plan of care. So, step in nursing process planning gihapon to plan their priorities that have to be set. First, we have to determine which problems require immediate or less attention. In other words, that the most serious way to determine priorities of needs. These priorities can change as new problems arise or are resolved. A method used is Maslow's hierarchy of human needs. Chapter 4 na siya. So, ang mga prioritizing nursing diagnosis. Mo na siya ang mga human needs. Example sa nursing diagnosis. Imbalance, nutrition, less than body requirements. So, physiological, ineffective breathing pattern, mga pain, impaired swallowing, urinary retention. So, muna siya mga examples niya sa nursing diagnosis: risk for injury, impaired verbal communication, disturbed throat processes, anxiety, mga fear, social isolation, impaired social interaction, interrupted family process, parental role conflict. So, Einstein and self-esteem, disturbed body image, powerlessness, caregiver role strain, infective breastfeeding, delay growth and development, spiritual development. Sumo ni siya mga establishing goals. Unsa ang mga goals? Goals are expected or desired outcomes. So, ang mga goals, makatabang po na siya sa mga nurse to determine if the nursing care done is appropriate for nursing diagnosis. They can be short-term or long-term. An example of goal, mano siya mga example sa goal. So, the client will be well hydrated by 10 to 23. An example of outcome, more specific, the client will have adequate hydration as evidenced by an oral intake to 3,000 ml 24 hours by 8 to 23. So, kung mayon kag short-term goal na pod, mo ni siya mostly by nurses in acute care setting. Mo ni siya mga goals nga pangbuhaton sa short term. Mo ni siya na few days or 1 week have the following characteristic. Mo ni siya na box to 7 example. Mo ni siya mga example are developed from the problem portion of the diagnostic statement or client center, what they can accomplish, measurable, identifies, evidence of goals unachieved, realistic, avoid attainable goals, a campaign by a target date for accomplishment, term, long-term goals, muna siya mga outcomes, takes a few weeks or months to accomplish. Muna siyang usually done for client with chronic health problems requiring extended care in nursing home or community health or home health service, mga stroke or partial functions. Mao ni siya pod ang mga goals for collaborative problems. Focus on what the nurse will monitor, mag-record, mag-report, or do to promote early detection. So, mao ni siya, 6 sample in book. So, selecting nursing interventions. Muna siya, mga critical thinking is required to accomplish goals. Nursing interventions include evidence-based knowledge to produce desirable and safe effect, also directed to eliminate the cause. Muna siya, mga documenting the plan of care. So, plans of care can be written or printed forms or can be computer generated. It is a requirement by the Joint Commission that each patient has a plan of care. Muna siya ang mga documenting the plan of care can be written by hand, computer generated, nursing orders are signed and provide specific instruction for all health team members to follow and provide care. So, communicating the plan of care, nursing share the plan of care with nursing team, family members, and the client who signed the care plan. The care plan is kept for facility policy followed and revised daily according to changes in client conditions. Muna siya nga who makes the health team. So, kinsa man ang magkaan. So, ang primero gyud is ang formalist. So, mauni ang mga kung who makes up the health team. So, mauni siya na makita ninyo diri sa mga pictures kung kinsa ang mauni sila ang mga health team. So, makita naman ninyo kung kinsa ni sila. So, diri na ta sa implementation is the fourth step in the nursing process. The nurse implements medical orders as well as nursing orders. Implementing the plan involves clients, members of the health team. Medical record has evidence of care, both quantity and quality of the client's response, maintaining open lines of communication, client's continuing progress, complies with standard and helps ensure reimbursement, government or private insurance. So, muna siya ang example of nursing care. Date, problem, nya iyang goal, nya target sa date, o nursing orders. So, diri na to sa evaluation. Mauna na siya ang final step sa nursing process. So, it helps the nurse to determine if the client has reached his or her goals and how effective the nursing care was. Can be done with the client and or family or the nursing team conference. The NP is the standard for clinical nursing practice. Nurses are held accountable by Nurse Practice Act for demonstrating all the steps in the nursing process, because to do less implies negligence. Mao na siya ang use of nursing process. Mao na siya ang concept mapping. So it's also called care mapping, and is a method of organizing information in graphic or picture form. Mao na siyang example. Concept mapping, mo na siya ang mga advantages sa nursing process. Allow student to integrate previous knowledge with newly acquired information, enable students to organize and visualize relationship between their current academic learning and new client assessment, increase critical thinking, all clinical skills, enhance retention of knowledge, correlates theory recognize information to provide safe, effective client care, better time management, to collect client data or identify problems, to organize data, makes process simpler, to analyze data or normal, abnormal, clues of problems, to identify risks, help staff to plan treatment, prioritize problem list or immediate needs, setting goals to prevent to resolve problems, give specific direction for nursing care as this specific direction provides consistency among caregivers. See nursing guidelines.